A whole foods, plant-based diet based on sustainable, natural, and organic farming methods and macrobiotic principles could be a vital part of the international response to the coronavirus that started in China and has now started to spread around the world, says Alex Jack, president of Planetary Health Inc., an international health and environmental organization with headquarters in the Berkshires. A macrobiotic diet centered on whole grains, beans, fresh vegetables, sea vegetables, and other predominantly plant-quality foods can boost natural immunity to disease and may help prevent the onset of the coronavirus and assist those with the disease recover, Jack stated. While we have no direct experience with treating corona yet, a macrobiotic approach has been effective in helping to treat HIV, AIDS, and other serious potentially fatal viral and bacterial conditions. Bettina Zamdik, Culinary Arts Director of Planetary Health, stated that the macrobiotic approach to coronavirus was similar to that of AIDS, Ebola, and other potentially lethal viral diseases. She noted that medical researchers in Japan found that Umeboshi plums, a traditional salted aged pickled plum and a staple in the macrobiotic way of eating, contain a substance that can suppress the growth of the H1N1 virus that led to the swine flu epidemic several years ago. When applied to affected cells, researchers reported the growth of the virus was suppressed by nearly 90% after 7 hours. We strongly support the international medical relief effort for corona and encourage natural and organic farming practices and dietary prevention and nutritional relief by individuals, communities, physicians, and humanitarian relief organizations as a key element in halting the contagion, Zamdik concluded. In 2014, Planetary Health launched a website with dietary advice on Ebola crisis, another deadly contagion associated with infected animal food. www.ebolaanddiet.com. Dr. David Denning, Professor of Infectious Diseases in Global Health, University Hospital of South Manchester, United Kingdom, endorsed the recommendations on Planetary Health website. Sensible and nutritious dietary advice and real behavior change is needed across the Western world. Red meat eating, less so chicken, contributes big time to water shortages and global warming, as meat is an inefficient source of protein compared with fruits and vegetables. I suspect that even 2 days of macrobiotic food would be a great improvement on many people's diet. There is much your advocacy can offer the world. Alex Jack has written or edited over 25 books on diet and health, collaborating with Michio Kotzsche, leader of international macrobiotic movement, who came to the United States from his native Japan 65 years ago. Kotzsche and Jack are the authors of many books including The Cancer Prevention Diet, The Macrobiotic Path to Total Health, and AIDS and Diet. Over the years, the macrobiotic movement have cooperated with World Health Organization, National Institutes of Health, Centers for Disease Control and Prevention, National Cancer Institute, and other public health agencies in a dietary approach to heart disease, cancer, and other chronic diseases. Jack and his associates Bettina Zamdik and Edward Esco are currently undertaking a whole foods, plant-based dietary intervention study for patients with type 2 diabetes that has been approved by the Berkshire Medical Center, the region's largest hospital. At the International AIDS Conference in Paris in 1986, researchers from Boston University reported that HIV/AIDS patients with moderately intact immune function stabilized on the macrobiotic diet increased their T4 positive cell and lymphocyte counts, and that the average survival time had already surpassed any AIDS groups under study until that time. In 1987, Michio Kushi, his wife Evelyn, and a team of macrobiotic medical associates were invited by the government of the Republic of Congo to visit Central Africa and give a symposium on the macrobiotic approach to AIDS in Brazzaville. The conference was held at World Health Organization headquarters and attended by 200 medical doctors, including many traditional healers. Zamdik also quoted Dr. Benjamin Spock, who practiced macrobiotics during the last decade of his life. Dr. Spock wrote in the last edition of his best-selling book, Dr. Spock's Baby and Child Care, that within 2 weeks of starting macrobiotics, he cleared up a long-standing infectious condition with diet. My chronic bronchitis went away after years of unsuccessful antibiotic treatments. For further information, including dietary guidelines and home remedies, please visit www.ebolaanddiet.com. For further information on macrobiotics, visit www.macrobioticssummerconference.com.